Assisted dying is hugely controversial. The subject polarizes opinion, but it's a difficult conversation we all need to have because death ultimately affects us all. And after patients, it's the country's doctors who will be the most affected by any change in the law. Today we'll hear from two of them, one for assisted dying, the other against.
My name is Dr Jacky Davis. I'm a consultant radiologist and I am a campaigner for assisted dying legislation in this country. We know that hundreds of millions of people abroad have access to assisted dying and that no jurisdiction has reversed their decision, and we know there has been no threat to vulnerable people.
My name is Dr Mark Lee and I am a consultant in palliative care. I have worked in this field for 25 years and looked after thousands of patients at the end of their lives. I am against the assisted dying bill because I believe it poses risks to patients, to families, to doctors and to palliative care.
What's wrong with the status quo as it is?
Status quo at the moment means a number of people are dying bad deaths every day. 300 million people around the world have access to assisted dying. More legislation is in the pipeline, and no place that has taken up a law on assisted dying has ever reversed it. So we can learn from other places, we can get this right, we can offer people a compassionate choice at the end of life.
Do you accept that you're failing your dying patients?
I think the NHS currently is not resourcing the situation enough to be able to provide the patients with the choice that they need to get the care that they need, and that because they are not getting the choice and because palliative care is patchy. But in my day-to-day work, and I've worked in palliative care for 25 years, normal death is peaceful, comfortable and does not involve people dying in pain.
I absolutely agree with Mark that the vast majority of people will die a peaceful death and do not have the need for an assisted death. And I absolutely agree with him that palliative care in this country has been treated abysmally. So what I didn't hear from Mark is there are people who have diagnoses where they know that they are likely to face a difficult death. What are you offering to the people who aren't going to die a peaceful death?
There is not any evidence that changing the law would actually decrease suicide. In fact, the opposite sadly is true, that people will, the number of people taking their own lives will increase.
These people are dying, but they don't want to die, and that, in my book, does not make them suicidal. It makes them that they wish to be in control of their death.
The NHS lurches from crisis to crisis, from one winter to another. Can it deal with the additional burden, if I can call it that, of assisted dying?
This is certainly not the time for doing this in the NHS. The staff I work with are extremely worried. There are many, many hospices who feel that people will walk away from this, from the job, if they have to be involved with this in any way. I think that this could break the NHS.
You're shaking your head.
I'm shaking my head because I think it's really important to take a step back and say this would be a very small number of deaths. And this is very small in terms of the other things that are coming through, big drug discoveries, big new surgeries, all the rest of it. This will be very small in terms of money.
Do you have no sympathy with patients in that condition who want a dignified death? Why would you not afford that to somebody?
I mean, I have lots of sympathy. In fact, Ashish, I look at the whites of the eyes of people every day with that. I stand in that place every day. And that is shameful that anyone in this day and age should die in that position. Jackie and I can agree on that. That is unacceptable. But it still doesn't justify the response that we meet suffering with killing someone, rather than addressing the needs that are in front of us.
You've got over 600 people a year estimated in this country taking their own life when faced with a terminal illness. My brother did it. And then you've got the dozens of people who are going to Dignitas every year. So on this side, you've got a really heavy weight of what's happening. On this side, you've got, well, this might happen, but there's no evidence of it in other countries.
We know that doctors are wrong 40% of the time when they try to predict someone's end of life. We also know that coercion can be an issue. And although that can be played down, coercion can happen in lots of subtle ways.
I think the important thing that you're not saying, and that is absolutely true at the moment, is that people who take their own lives at the end of life, who stop they voluntarily stop eating and drinking, which is nothing to stop you doing that at the moment. You can stop eating and drinking and kill yourself. You can ask to have your ventilator turned off, and nobody will come along and assess you mentally, your mental capacity. No one will do anything except turn the ventilator off, because that's what you've asked for. So the status quo at the moment is not acceptable.
What can you say to Dr. Lee to convince him that the country is ready and needs to introduce assisted dying?
You say you've looked in the whites of patients' eyes at the end, and I'd say looking into the whites of patients' eyes and listening to what they're asking for when they've been offered everything that you can offer them and they're still saying, I've had enough, then we should follow the example of other countries and say, we will help you.
There are a small percentage who do struggle, and we may struggle to get on top of, but we are learning all the time. The problem we have is from the jurisdictions in other countries. If we accept it for a small number here, that we are going to be risking the lives of others who are more vulnerable and less able to protect themselves. And that concerns me.
So those are the two very divided opinions of two NHS doctors, but these are the same arguments that will be taking place in hospitals, hospices, offices, factories and living rooms across the country. In about a week's time, it will be up to the politicians to decide on what could be the biggest change to British society in a generation.